Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll look at medications used to manage angina. We'll focus on how the major drug classes work to reduce myocardial oxygen demand, and most importantly, the key considerations for physical therapy practice. Before we look at the medications, let's briefly review angina. It occurs when the oxygen supply to the myocardium is not sufficient to meet its oxygen demand. Most commonly, this occurs because coronary artery disease limits blood flow to the heart muscle, particularly when demand increases during activities such as exercise. This gives us the basic goal of medications used to manage this condition: either reduce how much oxygen the heart needs or improve oxygen supply to the myocardium. We'll focus on three major medication classes: nitrates, beta blockers, and calcium channel blockers. Although each works differently, they share a common goal: improving the balance between myocardial oxygen supply and demand. Nitrates primarily reduce preload, beta blockers reduce heart rate and contractility, and calcium channel blockers reduce vascular resistance, with some also slowing the heart. For each class, we'll look at how it works and, most importantly, the key considerations for physical therapy practice. Let's start with nitrates. Nitrates increase nitric oxide, which relaxes vascular smooth muscle and causes vasodilation. Their primary effect is venodilation, which reduces the amount of blood returning to the heart, or preload. With less blood to pump, ventricular wall stress and myocardial oxygen demand decrease, helping relieve symptoms. For physical therapists, nitrates may be prescribed before activity to help prevent exercise-induced symptoms. However, because they lower blood pressure, watch for orthostatic hypotension, dizziness, and headache. With continuous exposure, patients can also develop nitrate tolerance, which reduces the medication's effectiveness. Next, we have beta blockers, which reduce sympathetic stimulation of the heart, decreasing heart rate and contractility. In this case, the key effect is reduced myocardial oxygen demand. By slowing the heart and reducing how forcefully it contracts, beta blockers decrease the amount of oxygen the myocardium needs, particularly during activity. For physical therapists, remember that beta blockers blunt the normal heart rate response to exercise. Heart rate may not increase as expected with activity, so RPE can help guide exercise intensity. Also monitor for bradycardia, fatigue, and reduced exercise tolerance. Lastly, we'll look at calcium channel blockers. By decreasing calcium entry into vascular smooth muscle, these medications promote vasodilation and reduce afterload. This decreases the resistance the heart must pump against and helps reduce myocardial oxygen demand. Some calcium channel blockers also act directly on the heart, decreasing heart rate and contractility, which further reduces oxygen demand. They can also improve coronary blood flow through coronary vasodilation. For physical therapists, watch for hypotension, lower extremity edema, and with some calcium channel blockers, bradycardia. Because these medications promote vasodilation, use caution with systemic heat, which can further lower blood pressure. Now, for the key takeaways. These medications are designed to improve the balance between myocardial oxygen supply and demand. Nitrates primarily reduce preload, while beta blockers decrease heart rate and contractility. Calcium channel blockers promote vasodilation, and some also decrease heart rate and contractility. For physical therapists, understand how these medications affect the cardiovascular response to activity and monitor blood pressure, symptoms, heart rate response, and exercise tolerance throughout treatment. That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.